So I think this is a really common question that people ask. I think headaches are something that we all get in our lifetime and at least several times a year. So differentiating a headache from a migraine can be challenging, but essentially I'd say a headache differentiates from a migraine. The migraine is more of a headache with character. So it's often more severe, lasts for longer. It may have other features like numbness, tingling, nausea, vomiting, visual disturbance, watering eyes, and finding light is disturbing or painful, needing to go away, have a sleep, not being able to function. So it's really, I'd say a migraine is a headache with character. In terms of whether it's something more serious, patients do often worry that their migraines are a presentation of an intrinsic brain problem. It is very rare to see, things like brain tumors presenting as migraines or headaches, but the differential would be, a very severe headache or migraine that is in a new onset, that is very unusual for you as a patient, is not going away with pain relief, is keeping you awake at night. Those are the sort of real red flags for a serious internal cause for your headaches, which is not a simple headache or migraine. And if a patient had any of those kind of red flag features, then I'd say you need to seek medical help as soon as possible through a emergency department or your GP. Yeah, so that's a really common question patients ask as well. I mean, often to achieve that, you need to keep a headache diary where you kind of keep a list of your attacks, what's happened, what you've done in the days leading up to that. The commonest triggers would be lifestyle, to be honest, things like your sleep pattern, your stress levels. It's very common to see patients going through a stressful time or deadlines or a big life event coming up that causes their headaches or migraines to escalate. Another common cause is dietary things or nutritional, such as alcohol is a key trigger. Caffeine can be a key trigger for patients. Certainly some food types like cheese or nuts, classically people talk about, can trigger headaches or migraines, but it can be very individual. So as I say, I think a diary is very useful, and sometimes you need to cut things out or try things out and see if that helps with the headaches or migraines. And if you can find a trigger for yourself, that's extremely helpful in terms of reducing the frequency. Movement and exercise can be really important as well, because posture can often lead to strain around the neck and head area, which can then cause headaches and trigger migraines. So I think just being mindful of your time on screen and your getting your eyes checked for eyesight, etc. So just having a general look at anything that you can do to help reduce or prevent your attacks. Yeah, so I think with an attack, I think the earlier the treatment is taken is the better. So it could be simple things you get over the counter, like paracetamol, ibuprofen, aspirin, just to check you're safe to take those, but they can be very, very effective. If those type of medicines aren't working, and by the time most people see a GP, they've already tried those, there are stronger painkillers that we can issue, which may be sort of codeine-based things, which can help some patients, or more specific medications for migraines. The most common ones are called the triptans, which are a group of tablets like sumatriptan, rizatriptan. There's several of them, and these can be taken in different forms, such as tablets or wafers that dissolve in the mouth, or sometimes injections or a nasal spray. It depends, what route is best for that patient. But the idea is to find a tablet that's effective for the patient that they take early in the attack. Some patients also need to combine that with anti-sickness medication if nausea or vomiting is a part of their attack, because obviously that makes you feel unwell, but also can prevent you absorbing the other anti-migraine medication. So it's quite personalized. There are sort of newer medications around which can be issued, which are more under the realm of one of the specialists. But I think those are the main ones that we've covered. Sure. So, if somebody's getting 1 or 2 attacks a year, you probably deal with those when they come along. But certainly once you start to get 1 or 2 attacks per week, I think that's the point where most doctors or specialists would think about preventative medication. So again, for myself as a GP, I'd go straight back to basics and take a real history and try and get an idea what's going on. And we'd look for any sort of underlying causes in terms of lifestyle or any underlying medical conditions or other medicines that are potentially triggering the attacks. But then there are various types of medications that can be used for prevention. Some types of blood pressure tablets work well. There's 3 types actually, which can be used at low dose without getting technical. There's calcium channel blockers, beta blockers, and ACE inhibitors can all be used to prevent migraines. There are sort of some anti-epileptic type medications or anticonvulsants which are used at a low dose, which can also help. And through the specialists, there's other medicines available. There's a new group called CGRPs, which are newer medicines. They're sort of monoclonals which have come through. And some specialists will use Botox injections around the head and neck, which can be very effective for some patients, and nerve blocks. So there's actually a large range of options, and it's often trial and error for each patient. Sometimes a low dose of an antidepressant type medication, such as a SSRI, like one of the Prozac type drugs, or amitriptyline, which is an older antidepressant, can be very effective. So it's really a question of discussing with your GP or specialist and then finding out what works best for you. And it may be a case of trial and error, trying 2 or 3 things before you find one that's effective. No, absolutely. I mean, we've touched on this earlier in the interview, that lifestyle is fundamental to, management of migraine, in particular sleep, improving your sleep hygiene and quality, and looking at your stress levels. The other thing is kind of posture, as we've discussed, so that you don't end up with a kind of neck strain from using your screens, your mobile devices. That's a common trigger for the headaches and migraines. Keeping your movement up, so exercise, movement, keeping regularly moving around is very helpful. And then all the other dietary stuff we talked about, such as alcohol and caffeine, to try and kind of minimize those as well, because they're very common triggers. So lifestyle is hugely important in terms of headache or migraine prevention.